also known as the Hotline. I want to welcome you to this very timely and important conversation on the impact of COVID-19 on survivors of domestic violence. I'm joining you from Austin, Texas, where the Hotline is located, and I want to take a moment to recognize the tremendous impact COVID-19 has had on all of us. We are adjusting in so many ways, from working from home, caring for loved ones, social distancing, and deciding when and how to re-enter our daily activities. I also want to take a moment to honor those who have lost their lives to this pandemic and remember the families and loved ones as they grieve. I would be remiss if I didn't also mention the acts of violence against George Floyd and far too many Black Americans today. As a society, we must actively work toward dismantling the systems to oppress Black, Indigenous, and non-Black communities of color that far too often impact many of the survivors we work with daily. In this moment, it is crucial for allies to show up for communities closest to the pain and address institutional racism. In times such as these, it is not enough just to abstain from racist practices and policies, and I hope you will join us in standing in solidarity with Black leaders and activists on the front lines of this struggle for justice. Today, we are here to talk about proactive responses during COVID-19 to prioritize the safety of domestic violence survivors. We are pleased to have with us today Elizabeth Darling, the Commissioner of the Administration of Children, Youth, and Families, that I'll now refer to as ACYF, at the U.S. Department of Health and Human Services. Commissioner Darling leads two bureaus at ACYF, the Children's Bureau and the Family and Youth Services Bureau. The Family and Youth Services Bureau supports the Family Violence Prevention and Services Act, or FYSB, which provides primary federal funding streams dedicated to the support of emergency shelter and supportive services for survivors of domestic violence and their dependents, including the Hotline. Commissioner Darling, thank you so much for joining us today. Would you tell us a little bit about yourself?
I'd be glad to. Thank you so much, Katie. It's great to be with you all today via Zoom. And as you said, this is a very, very important life-saving topic that we're discussing today. I'm joining you from Washington, D.C. I did spend the last month back in Texas, which is my home, and then came up last week to be closer to the office, just in case. I, like many of you, are ready to get back to whatever. It's important that we hear directly from you in the field so that we better understand what the conditions of people experiencing intimate partner violence, especially as the pandemic continues and impacts our communities. And I'm glad that we have the space here to share an update. I think that you did mention that the Family and Youth Services Bureau and I will also add the Children's Bureau fall under my purview. The Children's Bureau closely related to the subjects we discuss here around child abuse and neglect, foster care and adoption, and the Family and Youth Services Bureau, Family Violence Prevention and Services, which brings us here, adolescent pregnancy prevention, and runaway and homeless youth. Well, thank you, Katie, for the opportunity to be with you today.
Well, thank you, Commissioner Darling. Let's go ahead and dive right in. I think it might be helpful to start first by just talking a little bit about the Hotline and Family and Youth Services Bureau. The Hotline was first established in 1996 by the Violence Against Women Act, and it's the only 24/7, 365 national organization that directly serves victims of domestic violence, their friends and family via phone, chat, and text. Our work rests on three pillars: crisis intervention, prevention, and systems change. For nearly 25 years, the Hotline has been providing validation, safety planning, connection to resources, and hope to survivors of domestic violence. We also advocate for funding and policies that center many of the needs of survivors and create better options for safety, whether they choose to stay or leave their abusive relationships. Maintaining our services is critical to the health and safety of survivors across the United States and its territories, particularly in moments like this one. Commissioner Darling, I'll turn it over to you to share a little bit about the Family and Youth Services Bureau.
Thanks. I'd love to talk about FYSB, as we call it. The services like the hotline are supported through the Family and Youth Services Bureau, affectionately known as FYSB, within the Administration on Children, Youth, and Families. FYSB supports programs that provide shelter, supportive services, and education for youth, adults, and families. For 35 years, HHS and FYSB have been committed to supporting organizations like the Hotline that provide critical resources and support to individuals and families affected by domestic violence and dating violence. In particular, the Family Violence Prevention and Services Act, or FVPSA, has provided over $78 million to the hotline since it first opened in 1996. That support has allowed the hotline to be there when a domestic violence survivor or a concerned loved one reaches out for support. As a result, the hotline has answered more than 5.3 million phone calls, online chats, and text messages from people affected by domestic violence over the course of nearly 25 years.
Thank you, and we are so grateful for the incredible support and partnership that not only the FYSB office, but the FVPSA office provides to the hotline and many of the resource centers across the country. And certainly as the former direct service provider in a shelter, the incredible difference it makes in providing critical services. Both of us are working remote, like so many throughout the US. Your background looks much better than mine at the moment. I'm having some background envy. In fact, here in Austin, the entire hotline team, more than 160 people, began working remotely in March to continue providing critical life-saving services for hundreds of thousands of survivors, no matter what happens. Our top priority remains keeping staff safe while serving survivors, and this means maintaining a focus on the mental and physical wellness of all of our staff, but especially our advocates who are on the front lines every day, every hour of the day, hearing really distressing stories that survivors are experiencing right now. Commissioner Darling, what transitions have you been noticing within your team and in the field?
Well, Katie, as you know, our staff is also working remotely since the middle of March to continue our work and ensure safety for our team. And I will say that since the beginning of March, across all of HHS, in particular the Administration on Children and Families, we worked very quickly to try to assess the operational impacts across all of our programs, the increased need for services, as well as barriers to accessing those services, and provide additional funding, waivers, flexibilities that we hoped would help you do your work. The ways in which COVID-19 is impacting survivors and those providing services, as you well know, is extensive. Shelters across the country have had to adjust, not only because of the increased need and the limits that have become necessary as part of the public health regulations and rules, but also because they need financial support to ensure services and meet increased needs of survivors. They're doing the best they can to serve the needs of local survivors, but the challenges are immense. We also recognize that shelters and other resources are stretched to the limit due to COVID, but every shelter we know is working hard to keep the residents safe and do what is best for local communities and in coordination with local health departments. Katie, the challenges are very real, but we're all dedicated to serving survivors despite those challenges.
Commissioner Darling, many of us have been on the front lines for years now and hope to see the tide turn and the numbers go down, but we know that's not happening. And as we're hearing from other countries, as shelter-in-place orders are lifting, higher numbers are being reported. The hotline has answered more than 362,000 calls, chats, and texts in 2019 alone from friends, family, survivors, all needing support. Of those who reported an abuse type, 91% report emotional abuse and 61% reported physical abuse, while 30% are reporting digital abuse, and that's up 101% from last year, and then 25% reporting financial abuse. And sad to report that nearly 82,000 of our contacts reported that their abusive situation was involving children. The heart of the hotline is our highly trained advocates and our staff who provide high quality trauma-informed education, validation, and connection to services that empower victims and survivors to make life-changing decisions with dignity and respect. And I'm deeply proud of the work we do here with the entire Hotline team. And so Commissioner Darling, I guess for you, like what are your thoughts on that, and how do you feel the FYSB office will respond? I think we've lost Commissioner Darling for a moment.
Here we are.
There we are, we're back, yay.
I was going to call on my cell phone just because of that. My apologies. So we're all having to adjust to a world filled with technology, I know.
This is
so
true.
Right, so we know that we have to express that domestic violence is and has been a public health epidemic in our country and globally for pandemic has exacerbated the needs of survivors and the urgency with which we must address those needs. 1 in 3 women and 1 in 7 men will experience severe violence from an intimate partner in their lifetime. 1 in 3 teens will experience dating abuse. Those statistics have been the norm for far too long, and that's not acceptable. Even when the major threat of this pandemic is over, the long-term effects of health and safety of survivors must be a priority. This pandemic, and specifically stay-at-home orders, have added pressure to difficult situations where domestic violence was already occurring. So Katie, can you tell us what you see from your place as a national service provider?
Yeah, I think, that's an interesting time. And I think the question we've been getting asked a lot by media was really what prior experience do we have to prepare ourselves for the pandemic? And we haven't seen anything quite like this. Obviously, we've seen natural disasters, the economic impact in the late 2008, 2009 certainly provided some data for us to be able to anticipate what we might see during the pandemic. We know that any situation that adds stress, financial strain, or isolation puts survivors even more at risk. And unfortunately, this pandemic has elements of all three. We know that during the month of March, stay-at-home orders were issued in communities across the country. That meant survivors were in close proximity to their abusive partner. And this likely played a role in survivors being unable to reach out for support in ways that were safe. As a result, in the very beginning, like many other hotlines across the country and what shelters were reporting to us, that we did not experience an increase in contact volume in the very beginning. However, in the beginning of April, we began to see a small increase in our average contact volume. And we kind of were hearing just really from survivors that they were establishing new normals. They were finding opportunities where whether they were going for a walk or their abusive partner was leaving the home, they would find small windows of opportunity to connect for help. So incoming contact volume for the hotline in April was 15% higher compared to April of 2019. The hotline is responding to unique challenges that survivors are facing in light of the coronavirus pandemic, or what we're all calling COVID-19. And we began to track data around March 16th around how COVID-19 was really impacting survivors. In total, from March 16th through March 25th, nearly a little over 66,700 survivors, which is roughly 10% of our total contacts, reached out to the hotline and cited COVID-19 as a condition of their experience, meaning that either their abusive partner was leveraging it to further isolate, abuse, control, or perhaps was presenting it as a barrier to seeking support and safety and accessing services. The stories that our advocates are hearing and most likely will continue to hear really paint a picture of what survivors continue to experience. And we've heard that survivors are really experiencing really just distressing situations with their abusive partner, whether that's they're really concerned because either themselves or their partner lost their job, and this is going to greatly impact their strategy, their financial strategy to leave the relationship. We know that oftentimes the abusive partner was leveraging COVID-19 as a means to say that their partner couldn't connect with friends and family. The critical support systems we know that survivors rely on every day to survive, and that there were a lot of feelings of anxiety and fear and hopelessness that were being amplified during this time for a survivor. We've already heard from survivors how the pandemic has exacerbated already difficult conditions or is keeping survivors from making choices for their safety. And I think advocates across the country, and including here at the Hotline, are really doing some uber safety planning, thinking outside of the box as we recognize that many of the safety tools that we provide to survivors may not be options right now. Commissioner Darling, like, what are you noticing as the effects of the pandemic continue to play out?
Thanks, Katie. One of the things that rises to the top is the ability to access technology. Technology that will allow advocates on the front lines to provide remote care and counseling. This has been the case for the Hotline, as you've mentioned, where all of your staff has been able to move to remote work to ensure their safety, as well as to continue to provide those critical services and supports for survivors in the moment. We have the shared goals of keeping advocates across the country safe from COVID and ensuring that survivors can reach someone whenever they're able to call. We've had all been frustrated by tech moments like mine just a little while ago, and may even have another one soon. But when their internet goes down or the video won't work, we know that the stakes are much higher. Our work is listening to survivors of domestic violence, and we don't want that lifeline to be cut. So the technology has to be there, and it has to be working well. The pandemic has shown us how critical it is to invest in reliable technology. And I will say, it's not just enough to have the technology, but if there is no internet access or Wi-Fi, especially in those rural places, on many tribal lands, the problem is exacerbated greatly. But we're pleased that some of the federal dollars made available in the CARES Act, which we'll talk about in a minute, can be spent on improving technology systems. So it's important to note that the impact of the pandemic has been especially devastating in Navajo communities. And Native communities. Native survivors of domestic violence face additional challenges of geographic isolation and limited economic opportunities and healthcare resources. And as I mentioned before, just access to Wi-Fi, internet, and basic technology. In response, FYSB has been a longtime partner with the Hotline and the National Indigenous Women's Resource Center to launch a helpline that connects Native callers with well-trained Native advocates who can provide emotional support, crisis intervention, safety planning, and referrals to Native-specific resources. Since it was created 3 years ago, the Strong Hearts Native Helpline has served over 7,000 callers. The $2 million CARES Act includes funding for the Hotline, and also an allocation of $500,000 for the Strong Hearts Native Helpline.
It's a great segue to our next topic around the federal response to ensure that survivors are served during this time. Commissioner, can you talk about the CARES Act and then beyond?
Certainly, the CARES Act stands for the Coronavirus Aid, Relief, and Economic Security Act, the CARES Act. It included $45 million to family violence prevention and services programs that provide shelter, emergency housing for domestic violence survivors across the country. It also includes funds for the Hotline, as I mentioned before, to provide those ongoing services so that survivors can still reach out for support as they are able, and safety planning during the time of heightened risk because of COVID pandemic. The hotline has received $2 million, as I mentioned, from the CARES Act, and it was one of the first national emergency spending bills in response to the pandemic and the devastating impact that it's having on communities across the country. I would like to say that this has heightened the awareness of the importance of family and domestic violence, dating violence, and the importance of the hotline up to the Secretary of Health and Human Services and to the White House and to Congress, all asking about how are we making sure that survivors have access and support during this particular time. The Family Violence Prevention Services Office is a resource that they need in order to help support survivors. And as such, we have built a network of support called the Domestic Violence Resource Network, DVRN. And DVRN informs and strengthens domestic violence interventions and prevention efforts at the individual, community, and societal levels. DVRN members work collaboratively to promote practices and strategies to improve our nation's response to domestic violence and make safety and justice a priority. DVRN consists of 2 national resource centers, 4 special issue resource centers, 3 culturally specific resource centers, 3 new capacity centers, and the National Domestic Violence Hotline. In response to the pandemic, the Family Violence Prevention and Services Office also has been offering what we're calling office hours, recognizing that each grantee within the DVRN network has been impacted differently by the pandemic and that there are varying impacts of the outbreak across the nation. We also know that it will be different as different parts, different jurisdictions, different states and territories reopen slowly. These regularly scheduled office hours are an opportunity to check in with grantees and hear how programs are doing and to provide time for everyone to ask questions of the family violence prevention staff.
Thank you, Commissioner Darling, and the hotline is incredibly grateful for the $2 million that we'll receive in support from the CARES Act, and it's timely as we see contact volume increasing. We are incredibly appreciative and grateful for the allocation for Strong Hearts Native Helpline, and we'll continue to ask for more adequate provisions for survivors who are members of underserved, culturally specific immigrant and Native communities. I also wanted to mention that as part of the allocation that the hotline received through the CARES Act, we designated funding to the Abused Deaf Women's Advocacy Services, a longtime partner of the hotline, to ensure that survivors from the deaf community have access to services during this time as well. Our last item that's important for those joining us today is we're hearing from people as they ask us how to support survivors during this pandemic. We want survivors to know that even in times like these, there's still hope, and we are here for them. And we know that providers across the country are working diligently to keep their populations and shelters safe and provide critical services and increasing access to services during the pandemic. And that isolation can be one of the strongest tactics an abuser can use. So building community around a survivor can be really critical, especially at a time like now. It's important to schedule a time to say hello from a distance or mail a postcard to let them know that they're not alone, recognizing that their perpetrator, their abusive partner, may be reading their mail or their text messages, but it is a time for us who know survivors. It's a good time to connect with them. Check in to see if you can be a part of their safety plan by scheduling a regular phone call, video conversation, or even setting up an emergency text system. Commissioner Darling, do you have additional suggestions of what people can be doing right now in this moment?
I'd love to share some ways, and I wanted to just say that I really appreciate you mentioning saying hello from a distance, mailing a postcard, or letting folks know they're not alone. I keep a stack of postcards and greeting cards, which get more expensive all the time. What a great way to connect. I try to drop a couple cards in the mail every week to those that I know need to know that somebody is there for them. We know that survivors are extremely strong and resourceful. We're amazed every day by their bravery and we'll do all that we can to transfer power back to them so that they can make informed decisions on what is best for their lives. Many people find themselves at home more and more, of course, and may observe concerning behaviors or abuse in their neighborhoods. This may include verbal arguments, they might notice aggression, and it's important to know what course of action is best to take. If you suspect abuse, but you're not quite sure, you can reach out to the National Domestic Violence Hotline directly or learn more at thehotline.org. You can make sure that people in your network that are at risk of abuse know about the different hotlines that are available 24/7, as the National Domestic Violence Hotline, the National Suicide Prevention Hotline, the Child Abuse Hotline, and the National Sexual Assault Hotline. So lastly, if you are inclined to consider supporting organizations financially, like your local shelters, please do, because they are always in need of resources and never more than they are today.
That's a great point, Commissioner. And if you're not sure where your local shelter may be or how to get in contact with them, you can contact us here at the National Domestic Violence Hotline, and we will connect you to that local program. That ends our time together today. I want to thank Commissioner Darling for taking time to join me in this conversation, and all for that you and your team are doing to ensure survivors are supported and have the hope of a safer future. I also want to thank all of you for joining us today via Zoom. And if you want to learn more about the hotline, please log on to our website, thehotline.org. Please stay safe, be healthy, and thank you.
Thank you all so much. Thank you, Katie.
Thank you, Commissioner.